We've got a couple options. Originally, we had most of our customers who did archival elected to just simply take the original patients and put it in the data source or application archive, using really either the existing MPI they had, patient identity or ID, or they used the existing MRN and account number simply and loaded that. As we approach patient consumerism, there's really a need to make sure that we have a true 100% patient ID match. So our second kind of in a good, better approach, the better approach is to take the demographics information from the source application and bounce that off the Go4DHR's MPI engine, in the case of Epic or Cerner as an example. And then our team will backload that MPI into our archive so that during single sign-on, there's an identity match and a one-to-one link between the patient from the Go4DHR to the archived record. Now, as that approaches, a lot of times there's still a mismatch or like 3 to 5% match, duplicates or erroneous kind of MPI match as an example. So the best approach actually is there's some providers in the marketplace that do what's called referential patient ID matching, which is really the gold standard, if you will, which in that case, it looks across the whole patient identity, across the whole health system, comes up with a better matching criteria and algorithm so that you really can get to 100% match. And why is that important? It's a little bit more work, probably a little bit more expensive, but at the end of the day, when you have to send patient data to the exact patient, you want to make sure you have that 100% match. So there's really kind of an option. So again, better, best approach, if you will, to be able to do that. And Harmony can handle all three of those approaches for you, depending on what your appetite is for that patient matching scenario. So originally, customers were doing that first approach where they weren't really kind of interested or didn't matter as much because the search criteria in our application would let them find the patient easily. But as folks are getting familiar with the Cures Act and the requirements that are coming for patient engagement and patient data sharing directly to the patient, that interest levels increased more to, like I mentioned, that kind of better approach and then the best approach. It's a little early. Again, customers are becoming more familiar with what the Cures Act entail. They're really looking at their production EMRs, but we're bringing kind of awareness to a lot of those systems. You're going to have to go back to 2016 for that data, and a lot of our customers were kind of in the gap of migrating to their Go4 application, past that period. So it's important to look at historic archive data as well as they're looking at that strategy.